This is the Health and Politics podcast. Prevention is the new cure.
And that's with former Minister James Bethell and myself, Steve Brine. Hello, James.
How are you, Steve?
I'm all right. Yes, I have the traditional January cold. But yes, it was my birthday yesterday, so I was celebrating, but when one is 52.
Oh, well, you're a spring
Yes.
chicken, Steve.
I am a spring chicken, yes. Do you know that there is still a WhatsApp group for former Tory MPs who, as in the Parliament, the last Parliament, there's a WhatsApp group. And there's lots of lively chat on there, which obviously shall remain private. But there is one member of Parliament who every single day posts happy birthday to whoever's day it is that day. And I just think he's just incredible that he does it every day. And of course, so it was my turn yesterday. So yeah, I had a bit of work to do yesterday, but spent all day with Monty the Labrador and went out for my wife and kids, which was actually rather nice.
Very nice. Well, in the Bethell household, we celebrate gratitude on our birthdays, and we talk about things that we've been grateful for. So, is there anything that you have been grateful for? I know it's the middle of January, and we're all feeling a bit under the weather, but
oh, mate, look, I mean, just grateful, grateful for the small mercies, you know, family and health and career that we've managed to furnish since I left Parliament. And you know, we celebrate half birthdays in our house. Have you ever done this?
no, I haven't.
Yeah, you're looking very quizzical.
Yeah.
Yes.
It's like a half bottle of wine. Yeah.
I know. So basically, we celebrate the dog's birthday in May, and then the dog's half birthday, and obviously my birthday in January, and then my half birthday 6 months through the year. Just thought it adds a bit of fun, you know, just because my birthday's at the end of January and my wife's birthday is in early February, the week after me. So we thought, well, that's rubbish time of year. The kids' birthdays are in the winter as well. So we have like half birthdays when we have summer birthdays, a bit like the Queen, you know?
There we go. Very nice.
Yeah.
So, Steve,
Anyway,
what are we going to talk about this week?
Oh, mate, so much to talk about. There's so much going on, isn't there? I think we're going to start by discussing how the UK has lost its measles elimination status. We'll explain what that means in a minute.
I know, very, very disturbing. And then we're going to have a look ahead at the new cancer plan, which we're hoping is going to be published on Wednesday next week.
So they say. After that, we're going to touch on what the NHS is doing to counter fraud. I know you've got thoughts on that and have been at a conference recently. And then there's a short interview, which I did earlier this week, James, with Juliet Bouverie, who leads the Stroke Association. And that's because today is Stroke Prevention Day. So we're going to unpack that a bit.
Excellent. Very, very important issue. And then we're going to finish up with some potentially exciting news, I hope, on bowel cancer of all subjects. And if we've got time, touch up on what's happening in the polls when it comes to health.
Which is really interesting.
Yeah. Measles elimination. I am so embarrassed that this has happened. It makes us feel like a third world.
Yeah. So for the listeners, so basically what's happened here is the UK's lost what they call its measles elimination status. The World Health Organization, which no longer has the US as a member, of course. So we now, I suppose, are the largest donor to the WHO because the US were. And basically, the move is based on the spread of cases in 2024. 3,600 suspected cases in the UK. What it means, James, is that measles transmission is considered to have become re-established rather than being truly interrupted in this country. And this is a worry, isn't it? I mean, I just wonder, you know, is this a bad blip or is it part of a longer trend which sort of somehow dates back to Andrew Wakefield, who was a British doctor in the 90s whose Lancet paper falsely linked MMR to autism, and that created this major controversy with lots of parents. Still now, the MMR vaccine has people who question it, which goes back to that time. So is this a blip or is this a long-term trend? I guess that's the question.
So I have a strong view on this one. I think Wakefield is still around. He's very potent in America and has an enormous business going on his anti-vaxxism. And he's a big celebrity there. But I don't think that's the problem in the UK. If you ask families, they have a lot of faith in vaccines, generally speaking. There are pockets of skepticism. Some communities where either for religious or home country reasons, they're skeptical. But really, I think this is more about the NHS and an ability to lose the skill of rolling out community-wide vaccines. Something has happened partly in primary care with GPs not really delivering. A lot of people in Britain now are just not engaged with the NHS at all. We've got 15, 20, 25% of people simply not seeing their GPs at all. We're not making it easy to book a vaccine. I've got 4 kids. It's a pain trying to get them all vaccinated. The Red Book thing is a disaster. Receiving appointments by letter, it just feels so old-fashioned now. And even waiting in a doctor's reception feels like such an analog, old-fashioned way of doing it. When we saw in the COVID how you could be doing it in football stadiums. So I'm actually chairing for the Royal Society of Public Health a commission on this, on vaccine access, and we're going to take some expert opinion. And I will be very interested to see what the super experts say on this.
Oh, yeah, interesting. Well, you must report back on that. I mean, just to give you the stats, basically, I mean, it's been declining childhood vaccination coverage over the past decade, for which
It has.
I suppose, both governments have got to take some responsibility for. So, the proportion of children receiving both doses of the MMR vaccine is below 85%, 85% below 85 in England now. So that's well under the World Health Organization's 95% benchmark. And so, none of the major childhood vaccines in England, not just MMR,
No,
have
no,
met
it's
their
all
herd
12 of them.
immunity up.
Yeah.
They've not met their herd immunity uptake targets in the last year. So, and several of them at the lowest for a decade. So, while that trend sort of began before COVID and everything tends to be blamed on COVID, I don't think you can just blame the C word here.
No.
We've got uneven coverage across regions. We've got the resurgence of measles and as I say, other diseases. And, I thought NHS England were quite defensive in their response to WHO
Yeah, 100%.
comms this week. And they're sort of saying, look, we've launched major catch-up campaigns, contacting parents who are not fully vaccinated, urging to book appointments. But to your point, are they making it easy for you to then actually do that?
No, they just aren't. And it does speak of a sort of obsession with complex acute care that consumes so much resource and sucks it out of basic disciplines like vaccine. But I really think we should try and fix this. It has a knock-on effect. And I read today about emerging data on the complications caused by things like COVID and flus that lead to loss of cognitive ability, increases in dementia diseases. Catching these diseases unvaccinated, it does, I'm afraid to say, have consequences later in life, and we need to crack it. We're just storing up trouble for ourselves in the future.
I think what NHS England, UK Health Security Agency would say is that from this month, so from January 26th, they're offering this new combined MMRV vaccine.
Yes.
So that covers measles, mumps, rubella, and chickenpox for children. And that is intended to sort of simplify the delivery, improve the uptake. But only time will tell. So I guess I would sort of say, James, in conclusion on this, look, losing the measles elimination status, I think it's a public health signal. It's a red flag. It's not an irreversible catastrophe. It highlights sort of sustained decade of coming in below the vaccination targets for quite a while now, regional gaps, and London particularly. But the system, and of course we're reorganising the system, has now got to work to reverse that trend and get us back in the WHO's good books.
Absolutely.
Yeah.
Absolutely. So, Steve, what's happening with the National Cancer Plan?
Well, James, so we haven't had a new national cancer plan in England since before I was the minister, and then when we published the long-term plan, we referred it during that time. Come back to that in a second. So it's very long awaited. My understanding is that it will be published on February the 4th, so that's next Wednesday, which is World Cancer Day. And I think for anything published by government, you've got to always consider the political and the fiscal context that they're operating in, and this plan will be no different. So in my opinion, James, I think ministers are going to be constrained and shaped by sort of 5 realities, and I won't go through them all, but I suppose probably primary in them is workforce. I mean, that remains the binding constraint, doesn't it, for the health system? And my experience of the NHS long-term plan and the cancer plan that I refreshed as part of that, and I was very honest about it at the time, is that we didn't publish a cancer workforce plan alongside ambition that we should diagnose stage 1, stage 2. We were just below 50% when I made that ambition. It's now just over 5%. So we're moving in the right direction. But that ambition I expect to survive into the new plan. But the thing to watch, and I'll say in a minute what we're going to be doing on this next week on the show, but the thing to watch is how closely the new National Cancer Plan works with the inbound new long-term workforce plan, the 10-year work plan that's being published. Because if it doesn't, it won't learn some of the lessons that I had from my time as the cancer system. Does that make sense?
It does, and you're absolutely right. These things are very, very closely tied together. I yearn and long for the day when we're not constrained by workforce restrictions and clinical um,
Mm.
under-resourcing. It's been a real problem in acute care, since we put all of our eggs in that basket 40, 50 years ago, that we just can't treat all the chronic disease we've got because we just don't have enough doctors and nurses to be able to do it. Nor are we ever going to. And the promise that somehow we're going to conjure up cohorts of new clinicians just is unrealistic. Everywhere in the world is short. So I just want to do a little bit of visioneering here, which is, I just dream of a day when there could be much more home-based treatment where we're using pills instead of surgery, where there's immunotherapies and remote radiotherapies that we can somehow do it from home. And I just really hope that the plan is that ambitious and isn't totally in the weeds about trying to jumpstart, sure, the technology of today, but also technologies which are very, very expensive, old-fashioned, and just aren't able to deliver on a population basis.
I mean, it's worth saying, normally when the government's releasing a big plan like this, is that the weekend before, so briefed into the Sunday papers, maybe the Secretary of State will do Koonsberg on
Yeah,
Sunday, and then they'll go for it in the week. But for weeks now, they have actually been trailing this plan. They've been
I
on
know.
visits about this plan. They've been making announcements that are part of this plan, and that's quite interesting as to show how important they consider the plan to be. The big test for me, as I say, will be around workforce, and it will be as to whether, like the NHS 10-year plan, as we've discussed, it's so full of ambition, and you can't fault that sort of Tiggerish ambition of Wes Streeting in the plan. Is that, will the cancer plan be full of great ambition and short on detail and short of implementation? Because if it's
Yeah.
that, then it's going to disappoint a lot of people in the sector. The other thing, just to say on this, is that, look, Treasury obviously are always so close to all of this stuff. I think they'll want to see a measurable return from the cancer plan, so they'll want to know that ministers will be under pressure to show that spending in cancer reduces costs, increases productivity, supports the economic growth narrative, gets people back to work. And breast screening, and then of course the big
But
prostate cancer screening decision are going to be central to that. So I think a lot hangs on this. Actually, the credibility of CH, a lot hangs on how good this cancer plan is and how believable it is to the sector. So CRUK and Macmillan, the big stakeholders in this space, as to how credible they feel the plan is.
well, you're absolutely right. I fear that if it really is a cancer workforce plan, and you have a point that sort of seems to be top of the agenda, then it just won't deliver a return. If we're catching half of cancers at stage 3 or 4, there's no way people are going back to work. There's no
Yes.
way it has a positive return for the Treasury. All we're doing, well, not all we're doing, we're giving people a longer life, and we're allowing them to die of something else, which is fantastic. But that isn't prevention. That's not on our agenda, and it's definitely not going to lead to workforce productivity gains or longevity. So we're back on the gerbil wheel of keeping people alive longer so that they can really be more of a burden on the Treasury. And if that's all that health does, we're never ever going to break free of this terrible nihilism and sunk cost problem. It's got to be more
Mm.
ambitious than just a bit more surgery.
Just end this sequence on a bit of optimism, if I may.
Yes,
So I
please.
think technology will be very, very central to this. It will fit, of course, with the analog to digital part of the 10-year plan. So there'll be technology optimism, but I think with caution. So, the MCDs, the multi-cancer detection test, GRAIL, will be the best known of that, which is the blood test that can detect early stage cancers. I think you will see quite a lot of nods to multi-cancer detection in the cancer plan. And I understand that the trial that NHS England are doing with GRAIL, led by Harpal Kumar, of course, who used to run CRUK, now is based in the States doing that. I think in May they'll be coming out the results, the multi-cancer detection stuff, and I think you'll probably see quite a lot of nod to that on risk stratification and how we use technology and how we use our early early indicators to try and catch more cancer early. So that's for what it's worth. But we'll be discussing it in more detail next week, James. And we have Professor Peter Johnson coming on next week to talk about it on the podcast, who is, of course, quite well known on the media, is the National Cancer Director, who will be coming on to talk about the plan and what we're missing.
Absolutely. Well, I'm very much looking forward to that. So what is the politics of, what's the political temperature at the moment, Steve? There is some good news and some bad news for the government at the moment.
What, on the polling? Well,
Yes.
it's just that, yeah. So YouGov do this monthly issues tracker, as you know, and you could look at it as good news or bad news for health ministers, couldn't you? Is that the NHS continues to track down the issues. So yes, it is still number 3 on the issues behind cost of living and immigration, but it's tracked down a couple of more points in terms of the issue that voters say is most important to them. It's a big parliamentary what's going on in Manchester, minus Andy Burnham, probably next month. So where's health going to feature in that? And you know what? I don't think it will very much. I think it will be all about immigration. It'll all be about Nigel Farage and his candidate versus whoever Labour decide to put up in their place. So, health is slipping down again, the issue of issues that matter to the public. And, the question you said to me before we started recording is, will health be an issue at the next election, let alone the by-election next month? And I mean, I guess that depends on how well the government do on it, doesn't it?
Yeah, it does. And I can't help thinking that this may go quiet for a little bit, particularly with the good job Wes Streeting is doing of emoting action and looking dynamic. But this is going to come back in the election really big time. We have that big tax rise at the beginning of the cycle. If taxpayers and voters can't see any return on that investment, I think things could get really bitter, and the reform machine is going to swing in really hard on this. They've seen how health has topped the US political agenda big time, and they've seen how Trump, as a Republican who wouldn't normally do much on health, has turned it into a really toxic issue and scored big points on it. They're going to try that playbook for sure.
100%. And it's something that Richard Sloggett, who was one of our special advisors at the department, was talking about on his Substack recently. I don't think you can underestimate that there is tension between Downing Street and the Department of Health and Social Care for obvious reasons, because obviously Wes Streeting is the Secretary of State. And, having secured all that money from the Chancellor, if he doesn't show that measurable return and he doesn't meet the Prime Minister's 18-week recovery target, then there's going to be big trouble. But of course, he may not be the Secretary of State by then.
Yep, I know. Well, that is a big possible change. So, can I tell you a little bit about something that I'm doing shortly, which is sticking my neck
fraud.
out a bit and speaking at a fraud conference. And these two things are linked. I can't help worrying, Steve, that in Britain we will go down a little bit of the American track of health becoming more controversial, because all advanced countries are facing the same types of problems about struggling to meet the chronic disease agenda and the workforce constraints. And it is getting bitter, and none of us are really cracking it particularly well. Huge amounts of money go into health. It is absolutely inevitable that some of it is wasted, some of it is not as productive as some of the rest, and that there will, I'm afraid, be some criminals who use the opportunity of these vast budgets to actually perpetrate criminal fraud. And it's a subject that is incredibly uncomfortable, because we'd all like to think that our colleagues and our friends who work in the industry act with great integrity, great thoroughness and thoughtfulness, that they are absolutely on top of all the fiscal responsibility that you would hope from public servants. But we also know that a lot of the practices are old-fashioned, that the technology is out of date, and that these are big budgets where accountability is not always crystal clear, and they're very, very vulnerable to fraud. So I was aware during COVID that this was going to be a danger for us as we spent a lot of money. I pay tribute to a lot of people who worked very, very hard to try to stop fraud from happening, and we did stop a lot, but some did get through, and I hugely regret that ever happened, and it does weigh heavily on my mind, if I was to be honest with you. So with the election approaching and this threat of a sort of populist poke at the fraud problem, and also an acknowledgement that this probably is a serious issue, I'm leaning in a little bit and speaking at a conference on public sector fraud generally, but with NHS colleagues to address what could be, should be done in order to crack down on this problem.
Yeah, this is the counter fraud conference, isn't it? You're speaking at next month. Interesting. I mean, the figures are cool, James. I mean,
Yeah.
you said to me that last year, the NHS Counter Fraud Authority identified, prevented, and recovered over £145 million in fraud, but the underlying vulnerability is significant. The NHS estimates it could be vulnerable to £1.3 billion annually. I mean, social care data is probably less complete than because of the number of providers. But I mean, is, as Ronald Reagan used to say, James, a billion here, a billion there. You're talking serious.
Yeah.
That's serious cash, isn't it, on to the patient care?
It absolutely is, and not only is it probably a lost resource and a breaking of trust with the taxpayer, it's also politically extremely dangerous. I mean, as we have seen, I don't know if you've followed much of the Minnesota stuff with the Somali community and what the
Indeed.
YouTubers are doing to target them. I worry that that could happen here in a different way. If you started having people poke at NHS finances or social care finances and started escalating stories into being politically toxic. What do you think, Steve? Do you think that could become headline stuff?
Could be. I mean, it's quite technical, isn't it? I mean, as ever with these things, it depends how
Yes.
it's couched and whether ministers and Treasury decide to focus in on it and whether they feel that it's going to complicate the message. But no, I mean, good for you for speaking on it, because it's not something that's talked about very often. It's that GP who faked the consultations that sort of brought this to the news agenda in recent days, isn't there?
That's
But
right.
no, good for you for speaking on it. We'll look forward to hearing you report back from that after you. Anyway, look, should we take a quick break and then we're going to
Yes.
talk, listen to the interview I did on stroke prevention.
Fantastic.
Welcome back. Thanks for listening to the Health and Politics podcast, Prevention is the New Cure. Today is Stroke Prevention Day, and an old friend of mine who I worked with when I was the Public Health Minister, Juliet Bouverie, who is the CEO of the Stroke Association, is joining us. Juliet, welcome to the podcast.
Delighted to be here.
Tell us, what's the big message then from the Stroke Association on this day?
Yeah, so I mean, we've got some alarming statistics. We know that stroke is horribly prevalent today. So a stroke happens every 5 minutes. But if no action is taken by the public and governments to help prevent stroke, we're going to see the number of strokes increasing to one stroke happening every 3.5 minutes. And as you well know, and your kind of listeners will know, stroke can be really devastating. I mean, it affects mobility and balance, but often speech and communication, eyesight, swallowing. There are all sorts of hidden effects, not least of which are depression, anxiety, trauma associated with having such a life-changing event. And what people don't realise is that actually 80 to 90% of strokes are preventable. So the big message that we want to get across today is what action both individuals but also governments can take to reduce the risk of stroke and to live healthy lives.
Okay, you're on our page. That's what we do. We do prevention, as you know. I mean, James and I are fascinated by some of the stats in the press release you put out around today. And I mean, the fact is, you say if we do nothing, if the government don't do anything, then the numbers will go in the wrong direction. Let's start with a positive. What are they doing to try and move us in the direction of reducing the incidence of stroke?
Yeah, so the government is listening. There are some really welcome measures in the 10-year health plan for England. So things like better labelling of alcohol, reducing junk food advertising, promoting healthier foods, going for a smoke-free generation. So we welcome all of that, but we'd like to see that delivered with greater pace and intention. The government has also set an ambition to reduce cardiovascular and stroke deaths by 25% over the next 10 years. That's great. But what we want them to be doing is kind of raising more awareness about the risk factors associated with stroke. 1 in 4 people still die of stroke. It's the single biggest cause of adult disability. And we want them in particular to promote the importance of health checks. What we know is that health checks are offered to everybody over the age of 40 in England and Wales, and yet 2/3 of people don't attend those appointments. So we want some stronger messaging about the importance of health checks, but also those health checks being really robust. All health checks should include a blood pressure check, an atrial fibrillation check, but also really good information and advice for patients about what they can do to adopt a healthy lifestyle, because unhealthy lifestyles do contribute to stroke risk.
So let's break them down. The sort of signs and symptoms, if you like, which, I use that term deliberately because you remember that I did quite a few signs and symptoms campaigns around cancer when I was the cancer minister. Everybody, I say everybody, lots of people will be familiar with the Act Fast campaign. The guy sitting in the terraces at a football match, could it be stroke? Is it time to reboot that? Is that what you're saying in terms of the public awareness of the symptoms of stroke?
Yeah, so I mean, there's been some research that has done that's clarified that most people understand that stroke is a medical emergency, but what people don't realize is that any one of the symptoms that are mentioned in the Act Fast acronym could be an indicator of stroke. So if your face droops, if your speech slurs, if you're struggling to lift your arm, any one of those symptoms could indicate a medical emergency, but so could other things like having a funny turn, blurred eyesight, kind of a migraine. We would always say act on the side of caution, call 999, because even if it's a mini stroke, it could be a precursor to a more major stroke happening in the next 7 days. So always treat it seriously.
Brilliant. So that's around public awareness, and then around the sort of getting checked. And you mentioned hypertension, high blood pressure in normal speak. So, when we set up Pharmacy First, I've said many times on the podcast, we wanted a hypertension finding service to be one of the main parts of Pharmacy First. It didn't actually end up being a main part of it, but as Community Pharmacy England, and I'm sure you work with them, go into negotiation this year on the new pharmacy contract, they really want to broaden out the hypertension case finding service into a proper hypertension management service. Presumably you stand right behind that. What would that look like, and what are the chances of it happening?
Yeah, so we stand absolutely right behind that. I mean, more than 50% of strokes are caused by high blood pressure. We know that there's 11 million people who've had their high blood pressure detected, but they're not always managing their medication to the required level. And there's 5 million of us who are wandering around, not even knowing that we might be living with a silent killer. So our big message is, please do get your blood pressure regularly checked. It's dead easy these days. As you say, a lot of high street pharmacies offer it for free. You can also get your blood pressure checked by your local nurse at the GP practice, but you can also order home blood pressure monitoring kits. They're very cheap these days. They're very good. And what we would say is check your blood pressure regularly, because if you get a high reading, it could be an indicator of stroke. And honestly, you really don't want to have to live with the burden of stroke. And the burden of strokes to the NHS and society is absolutely enormous. We know that if stroke prevention isn't taken seriously, the cost of stroke to the UK is going to absolutely rocket, and it's going to hit £75 billion by 2035. And some of that cost could just be avoided. So we all need to look after our own health, but also safeguard the health of the NHS when it's so under pressure at the moment.
Yeah, so I was going to ask you about that. The government were very clear in opposition that the Department of Health is an economic growth department. It's part of the growth mission. As you say, 1 in 4 people who have a stroke are of working age. Now, obviously, it doesn't take a genius to work out that if we don't reduce that incidence, that's hitting the working age population, that's hitting productivity, that's hitting economic growth. So, I just wonder, are you landing those messages, not just with the department, but are you landing those messages with Number 10 and Treasury?
You're absolutely right. I mean, it does need all government departments to take prevention seriously. And I think most members of the general public think the stroke only happens to older people. And as you said, 1 in 4 strokes happen to people of working age. And in fact, the age group where strokes are rising the fastest is people over the age of 50. And that's because, frankly, we're just a nation that is not adopting healthy lifestyles. We know 1/3 of members of the kind of public are physically inactive. Obesity levels are growing all the time. Unfortunately, people aged 55 to 75, we're drinking way beyond the government's recommended levels. There's too much salt in our diets. So all those things like stop smoking, try and eat more healthily, try and get physically active, reduce salt in your diet. All those things are lifestyle factors that we all need to take responsibility for. And we need government to be promoting that too. And I know there's a kind of reluctance for government to come across as a nanny state, but I think people don't realise the impact of some of those lifestyle choices. And honestly, we hear it from stroke survivors time and time again. Stroke is really devastating. And it's really tough to live with strokes. Just there are so many physical, cognitive, mental impairments that are associated with stroke. People can and do make great recoveries, but it's a long, hard slog. And we want to take every opportunity to reduce the risk of strokes happening in the first place.
Yeah, if ever there's an example of prevention being better than cure,
Yeah.
this is that, isn't it? And you mentioned the word nanny state there just finally, Juliet. I mean, the government they did take up the last government smoking legislation, credit to them. They have extended the high fat, salt, sugar, the advertising ban that we wrote in the child abuse plan. That's finally happened. Credit to them for that. Obviously, though, the government exists in a political reality, and they are very concerned about the threat from the populist right, who obviously doesn't share our view about interventionism. What sort of messages, you will talk to these people more than I do these days. What sort of feedback do you get from senior ministers when you talk to them about interventionism in public health for the greater good and for the economic growth mission that they absolutely have at the heart of their re-election push?
Yeah, I mean, I think there's genuine commitment from this government to act on the shifts in the 10-year plan, one of them being moving the NHS from a treatment service, or a sickness service rather, to a wellness service, and focusing from treatment to prevention. I think there's genuine intent. I think government needs to act with greater pace and rigor. The NHS needs to make sure that it's playing its part, because health checks are not as robust as they need to be. And the NHS needs to make every contact count. So every opportunity for somebody to have their blood pressure checked or their pulse checked, because atrial fibrillation is also a risk factor for stroke, needs to be taken by the NHS. But we're also saying it requires action from all of us as individuals as well. And, just things like getting your blood pressure regularly checked, it's so easy. It's so cheap if you buy yourself a home blood pressure monitor. You can just go to your local pharmacy. We can all adopt lifestyle changes. So I think it's a kind of collective responsibility. Yes,
Yeah.
government has a part to play. And yes, it needs to introduce the right legislative measures, and it needs to promote awareness about stroke and the importance of prevention. But so too does the NHS, and us as individuals have to play our part.
Yeah, I said finally, but I've got one more finally. The 10-year workforce plan is due out. I say imminently, probably. I suspect now we'll expect to see it in the spring, early summer. How important is that in terms of making every contact count? And, when people do present at ED, of course, you need to act fast. But you can only act as fast as the capacity that you've got. And although 18 weeks and recovering the elective backlog is where the government have placed all of its chips, actually a lot of public feedback is that it's the ED waits that's really people are really hurting around. You must be concerned about that. And are you feeding into the workforce plan?
Yeah, I mean, we're really concerned. I mean, one of the best bits of my job is working with stroke clinicians. I never cease to be amazed by how talented and committed they are. And we hear from stroke patients how much they value how person-centered and kind of caring our NHS staff are. So we had 91% of stroke patients in a big survey of over 6,000 stroke patients said that they felt treated with dignity and respect. But we are also hearing that they are feeling really tired. A lot of them are doing 2 or 3 people's jobs because of the levels of vacancies. And the government really does need to invest in the workforce, both to fill the vacancies, but also to skill the workforce up, to be able to operate in a digitally enabled age, to adapt to future changes. And I have to say, the level of engagement around the 10-year workforce plan is it's limited. And normally, like with the
Yeah, we've
10-year
heard that.
plan, there were lots of opportunities for our voices and evidence to be heard. It's all happening behind closed doors. And I think it's a wasted opportunity, because I think there are so many voices that could help to really create something that will enable the sustainability of the NHS for the future. So I just want to say to government, please, please, please prioritise investing in the gaps in the workforce, but also supporting staff morale, staff retention and leadership development.
And you've landed your message. I'll let you go. I know you've got plenty of other people to talk to. People want more information. They want the facts and some of the signs and symptoms that we've talked about. Stroke.org.uk. It's all on there. So there you go. There's Juliet, who leads the Stroke Association, as I said. And really, I mean, stroke is such a. You saw their press release that they put out, James, for Stroke Prevention Day. And I think you were struck by that stat that said in there about the number of people who will have a stroke while they're on their own.
I know. I remember when we were in a ministers' meeting once, and people talked about the diagnostics for stroke. I had one of those moments like in Three Men in a Boat when they start talking about the diagnosis, and I myself began imagining that I was having a stroke at the table. It's
my
the
God.
most
Suggestibility.
Well, I know, that's right. Comic
yeah,
moment.
yeah.
It's something that we all fear. But the good news is, if you do spot it early and you get someone to hospital quickly, they can treat it with the latest drugs and the latest treatments and get people back on their feet unbelievably quickly. So that's a long way from where we were many years ago, when a stroke could mean really a long and debilitating illness. And a lot of it is about public awareness. It's about the people that love you and care for you noticing that you've got something slightly off and not being embarrassed or British about it, and getting you to that ED as quickly as possible.
Yeah, well, as we talk about we were talking about in the interview there. I mean, yes, it is about recognising signs and symptoms. I'd like to see the Act Fast campaign, as I said, rebooted, but it's also about finding these undiagnosed high blood pressure cases, because they obviously are right. They are a risk. So anyway, I hope people enjoyed listening to that. Just to sort of wrap up this time, when I was fortunate to be the cancer minister, we commissioned the Poo in the Post.
Yes.
The National Bowel Cancer Screening Programme, which I believe that you have been a happy recipient of in recent days, James. Sorry about this.
No, not at all. No, I'm, incredibly impressed. I've got a nice blue box in the post, and I have just done it this morning. So, in knowing that you would press me on it, it's quite fiddly. It's not the nicest thing in the world, but it doesn't hurt. It's not a difficult thing to do. I've had children, so pretty familiar with the practice of looking after poo, and it will make a big difference. And the chances of me having bowel cancer are relatively low, but it'll save how many lives? 5,000, 10,000 lives this year?
Well, the reason why it's in the news and we're talking about it is basically NHS England enhance the bowel cancer screening program that we set up. So the aim is to detect thousands of more cases at this earlier, more treatable stage. It goes back to our 75% stage 1, stage 2 ambition. So from next month, obviously just a month late for yourself, but the new national screening program is going to lower the detection threshold for the home screening stool. That basically brings us in line with practice already in Scotland and Wales, actually, and they say that it should identify an extra 600 bowel cancer cases each year, and it's been backed up by Prince William, no less, who's been out there saying the importance of doing it, not being embarrassed, get it in the box and get it in the post.
Fantastic. Well done to everyone. And then the last piece of news, the new nutrient profiling model.
Yes, I saw this.
Yeah. I'm both pleased and excited that it's finally arrived, but I'm very depressed that it's taken 8 years and it's sort of a bit out of date already. It's sort of like having a black and white television delivered. Like, you're thrilled to have a new telly, but can't help feeling that there must be something new available.
Yeah, so it's quite technical, this, isn't it? And we were working on it when I was the minister, and goodness, I left 7 years ago. But for those who don't know, the nutrient profiling model, what that does is it helps define the products that are considered high in fat, salt, and sugar, which therefore couldn't be advertised watershed, for instance, under the new rules. And unless you've got the nutrient profiling model right, you don't know the drink products that fall or don't fall into regulation. And yeah, the Food Standards Agency have developed this, gosh, I suppose it would have been 20 plus years ago now, for Ofcom, the broadcast regulator, so they could identify what foods were and weren't in the advertising brackets. And now they use it for all sorts of different things. But yes, it is being updated. But yeah, it's a bit like online legislation. The minute you get royal assent, it's out of date. So I think we need to find a new. We'd have to invent the profiling model if we didn't have it, but I think we're going to have to reinvent it to make it more nimble, if that makes any sense.
Well, I think the other thing is this new emphasis on highly processed foods. That seems to be the revolution in the analysis. It just isn't calories like you and I were brought up to believe, although they are important. It is also the nature of what you're eating, and I think we've all slightly missed a beat on that. I didn't think that was going to have made such a big difference. I always thought it was all about the amount of sugar and the amount of, well, bluntly, the amount of energy that you're putting in your mouth. It doesn't seem that that's the whole story. It's these processes and the combinations of the salt, the sugar, and the fat, and just putting it through the machine and adding chemicals time and time again. That does seem to have a really nasty effect on our bodies, and that's contributing to obesity and also to the rise of all sorts of other diseases. So I think we've got a big reboot on our hand. I have no idea how this is going to happen. I've got scars on my back, as you have done, from trying to battle on food.
You're not kidding.
And yeah, I look up and down the country, and there's booming fried chicken shops absolutely everywhere now. KFC are opening 500 new outlets and are paying £10,000 for anyone who can find them a site. They are totally rocking and rolling, and so are all the other independents. Meanwhile, you and I are worrying about whether people are eating enough beans and greens. So there's a big gap here, I think.
Yeah, just you have to say though, the mini fillet burger can be lovely.
Oh, no,
Once a year or something. I mean, not the full fillet burger because I'm too fat and too old. As already said, I'm 52. Mini fillet, just occasionally. Anyway, always a pleasure. Nice chat. So much going on. Next week we're going to talk quite a lot about cancer, as we've trailed this week. We'll see whether the predictions that I've made as to what will be in the plan come true, and whether the plan actually makes it out next Wednesday. And we'll talk to Professor Peter Johnson. You can email us with your ideas, suggestions, and feedback, as people do, and you can find us on all the usual social media channels with your ideas and suggestions, because we love to hear from you, and we always reply. Do we not?
We do indeed. Thanks very much indeed, Steve. See you next week.
See you next week.